Hey everyone, and welcome back to the channel. Today we're diving deep into a condition that affects millions of people worldwide, but often flies under the radar: primary biliary cholangitis. So let's get started. First things first, what exactly is primary biliary cholangitis? It's a chronic yet progressive autoimmune disease that silently damages one of the body's most vital organs, the liver. The term primary in primary biliary cholangitis refers to the fact that the disease originates within the liver's bile ducts themselves, rather than being secondary to another condition. The term cholangitis means that the inflammation affects the bile ducts, particularly the small intrahepatic bile ducts. The key players in primary biliary cholangitis' pathophysiology are the immune cells, specifically a type of white blood cell called T lymphocytes and B lymphocytes. They mistakenly identify the cells lining the small bile ducts as foreign invaders. Eventually, this phenomenon will trigger an immune attack. The T lymphocytes directly attack and destroy these bile duct cells, causing inflammation and damage. Meanwhile, B lymphocytes produce specific antibodies, most notably antimitochondrial antibodies. These antimitochondrial antibodies are present in about 95% of patients with primary biliary cholangitis and are a hallmark of the disease. As the bile ducts are repeatedly attacked, they become inflamed, narrowed, and eventually destroyed. When bile can't flow out, it builds up in the liver, acting like a toxic irritant. This leads to chronic inflammation, which over time causes the liver tissue to scar, a process called fibrosis. As fibrosis progresses, it leads to cirrhosis, where the liver becomes hardened and unable to perform its essential functions. While primary biliary cholangitis is considered a rare disorder, it is the most common autoimmune liver disease. Being an autoimmune disease, it means that it can be associated with other autoimmune disorders like celiac disease, Sjogren's syndrome, or Hashimoto thyroiditis. It predominantly affects women, with about 90% of cases occurring in females, usually between the ages of 40 and 60. There's a genetic predisposition, meaning if you have a family member with primary biliary cholangitis or another autoimmune condition, your risk might be slightly higher. One of the challenging aspects of primary biliary cholangitis is its often insidious onset. Many people with primary biliary cholangitis, especially in the early stages, have no symptoms at all. It might be discovered incidentally during routine blood tests that show elevated liver enzymes. However, as the disease progresses and bile flow is increasingly impaired, symptoms typically begin to emerge. The most common early symptoms are fatigue. This is often the first and most debilitating symptom. It can range from mild tiredness to profound, incapacitating exhaustion that doesn't improve with rest. Pruritus, a persistent, intense, generalized itching, particularly noticeable on the palms of the hands and soles of the feet. As liver damage progresses, other symptoms can appear. Jaundice, yellowing of the skin and eyes due to bilirubin building up in the blood. Dark urine and pale stools, consequences of bile not reaching the intestines and excess bilirubin being excreted by kidneys. Xanthomas and xanthelasmas, small fatty deposits that appear under the skin, especially around the eyelids, due to high cholesterol levels from impaired fat metabolism. Abdominal pain, often in the upper right quadrant where the liver is located. Osteoporosis, impaired absorption of fat-soluble vitamins, like vitamin D, can lead to bone density loss. In later stages, symptoms of liver failure may develop, such as fluid retention, ascites, confusion, hepatic encephalopathy, and even gastrointestinal bleeding from enlarged veins in the esophagus, esophageal varices. So, how do we diagnose primary biliary cholangitis? Its first crucial clue is typically an elevation in liver enzymes, particularly alkaline phosphatase or gamma-glutamyl transferase. High alkaline phosphatase or gamma-glutamyl transferase levels suggest a problem with bile flow from the liver. The definitive diagnostic marker for PBC is the presence of antimitochondrial antibodies. A positive AMA test, especially when combined with elevated alkaline phosphatase, is highly indicative of primary biliary cholangitis diagnosis in about 90 to 95% of patients. To rule out other causes of bile duct obstruction, such as gallstones or tumors, we can use imaging as the key option. Initially, it is required an abdominal ultrasound, which can offer additional information about potential strictures or dilatations of the bile ducts. If the suspicion is highly suggestive, imaging like CT scans or MRI scan with multiple biliary sections can confirm the diagnosis. While there's currently no specific cure for primary biliary cholangitis, effective treatments can significantly slow its progression and manage symptoms. The cornerstone of treatment is ursodeoxycholic acid. This medication helps improve bile flow, protect liver cells from bile toxicity, and can slow the progression of liver damage. The total daily dose is about 13 to 15 milligrams per kilogram per day, and it's often taken for life. For patients with a suboptimal response to ursodeoxycholic acid, we can add another medication called obeticholic acid. We should see an improvement in the clinical and paraclinical findings in about 6 months of treatment. If the liver cirrhosis is already installed, treating cirrhosis complications will be the next therapeutic option. If the primary biliary cholangitis leads to acute liver failure, or if cirrhosis progresses to liver failure or liver cancer, a liver transplant may be necessary. Unfortunately, recurrence is thought to happen in almost 20% of the cases. And that wraps up our overview of primary biliary cholangitis. If you found this information helpful, please give this video a like, subscribe to the channel for more health insights, and let me know in the comments what other topics you'd like me to cover next. Thanks for watching, and we'll see you in the next one.